A very good morning to all of my audience. I will be discussing how to manage anger in children and adolescents. It's a tough task when it comes on parents and then they are asking for the help, and many parents are coming to clinical practice and then they are just asking that how they can manage tantrums which their children are throwing. Just let me give you an example. If my 3 years old daughter is asking me to take her to garden and if I am denying her request and she if she's getting angry, the very first thing I have to teach her that she has to connect that trigger with her emotions. Like, for example, I have to ask her that she has to draw her emotions on a card or on a page, whatever kind of image she can make, any horrible image, whatever she makes. So the very first thing you have to tell your children to connect triggers with their emotions, and then there are outcomes. Like, for example, if they are getting angry, then what they are doing. Like, for example, if she's getting angry when her emotions are negative, she's throwing things. She might be getting a bit verbally um, angry. She might be saying something a bit negative, or she might be getting verbally abusive, anything she might be doing. So we have to tell them that they have to connect their triggers with their emotions, and then they have to understand that whenever they are getting angry, what kind of that anger is having impact on their behavior. So same is the case when they are getting angry. You have to teach them basic skills that they can deep breathe, they can draw their anger, they can do coloring, they can listen to the music, they can do jumping exercises, they can go out, they can do running, or whatever they want to do. So you just have to give them a pause, you can give them a break, or any kind of activities what they like. So with that they can manage their anger. Now, another difficult area as far as adolescents are concerned, it's very hard for parents to manage their anger. Like, for example, if a 16 years old is coming to my clinic and the parent is asking that, it's very difficult to manage his or her anger. So for that particular age group, we often tell them the basic principles of CBT, like, once again, to connect their emotions um with the triggers, that what kind of antecedent is happening, what was the trigger, and what kind of behavioral consequences are happening, what was the antecedent, and then what kind of impact it is having on their emotion, and what was the consequences. And other anxiety management skills are also very effective for managing anger. Like, for example, deep breathing is very effective, and a progressive muscle relaxation are very effective. And they can go for jogging, they can go out with their friend, they can go out for meal, they can go out for any activity, they can go out for running, and then they can write their emotions. So they can put down list of they can just keep a diary or list on which they can just write down their emotions. So these are various small and basic techniques with which the parents then can teach them how they can how they can learn to identify their negative emotion, and then how they can manage their anger. So I hope that it would be beneficial for all of us. Thank you so much for your precious time.